Good morning. Welcome to the California Health Interview Survey CHIS Data User Webinar for legislators and media representatives. My name is Peggy Toy. I'm the Director of Health Data, a public service program of the UCLA Center for Health Policy Research, and I'll be one of your trainers today. On behalf of the center, I want to thank the California Endowment for its support of CHIS and today's training webinar. The California Health Interview Survey is the largest state survey for population-based health data for policy analysis, development and advocacy, and for service and program planning, and for research. Data from the survey are widely available, and we're going to demonstrate free online tools you can use to access CHIS data. These include AskCHIS, the health data query system for CHIS data, AskCHIS Neighborhood Edition, which is a GIS search tool for data, and then the COVID-19 dashboard. Joining me today in a presentation is Jacob Rosales. He's the CHIS Data Dissemination Manager. He'll demonstrate AskCHIS Neighborhood Edition and the COVID-19 dashboard. And we'll start with an overview of CHIS and a demonstration of AskCHIS. The California Health Interview Survey, the nation's largest health survey, it's the most comprehensive source of health information with a comprehensive range of health topics, which you can see a selection of some of the topics that are available in CHIS. More than 20,000 Californians participate in the survey each year, and they are interviewed on a wide range of topics. The survey participants include adults, teenagers with parent permission, and children by parent proxy. That is, the parent will answer questions on behalf of the child. CHIS is conducted in multiple languages, including English, Spanish, Chinese, both Cantonese and Mandarin dialects, Korean, Vietnamese, and Tagalog. Today's webinar is a basic overview of each CHIS data tool, how to use them to get CHIS data, how to read the estimates, and how to interpret the data. At the end of the webinar, we have a brief survey for your feedback and how to get assistance with CHIS data. So I'm going to start with a demonstration of the AskCHIS tool. So this is the center's homepage. And as you can see, there's a way to access CHIS, the California Health Interview Survey, with all of the information regarding the survey itself and the tools, the AskCHIS tools, as well as the COVID-19 dashboards. I'm going to start with the CHIS homepage because it gives you a lot of information that may be useful in your use of CHIS data and accessing it. First, there's background. You can also look at articles around the survey design and methods. There's a questionnaire for each year that the survey has been conducted, so you can see the questions themselves. You can also access CHIS data in other ways, and there's a link to find out how else you can access CHIS data for more specific sources of data for your own analysis, in addition to the free tools we'll demonstrate today. You'll also see publications that have used CHIS data for research, and you might find topics of interest within those publications. And then there's our tutorials, and we'll be referring to those throughout today, where you can get video tutorials that will walk through the same steps that we are using today. Also, some technical assistance articles on methods for analysis, as well as how to read the estimates and other resources and other videos related to CHIS data that might be useful. So now I'm going to go over to AskCHIS. And you can see on the AskCHIS homepage, you'll see AskCHIS and Neighborhood Edition that Jacob will demonstrate. For AskCHIS, if you're a first-time user, you're asked to set up an account. And that helps you to go back. You can save a lot of your queries in a library. And also it gives us information on what's of interest to you as well when you set up an account. You can use that same account for AskCHIS Neighborhood Edition. So I've been using this morning, so it goes right to the AskCHIS screen. And as you can see, at the top, there are 5 fields. These are variables that there are some that are mandatory that you need to select information to include in these fields, and that will help to produce the estimate. This user interface and behind it is a robust statistical application that draws from CHIS data based on the parameters you've identified, geographic area, topic, and so on, to produce the estimate that you may be interested in. So you can see in geographic area, it defaults to the state, but you can select other geographic areas as well. There are 58 counties in California, and they're organized by regions in AskCHIS, and you can see some of that here. Now, for some counties, Los Angeles County, because of its size, it is a region in itself. And then there are other Southern California counties that are listed within these regions. For Los Angeles County, as well as San Diego, you can look at smaller geographic areas using the Health Department Organization of Service Planning areas in Los Angeles County, or the health regions in San Diego County that have been set up by the Public Health Department. I'm going to select Los Angeles County for my query. Now, once I make a selection, I can go to next year, but it automatically populates the geographic area, the field rather, with the geographic area I've selected. And it then moves towards topic, which is our next required field. So as we see here, selected topic, a list of categories are displayed. You can also search using the search field for a specific topic, like for instance, asthma. And again, we see a list of questions that were asked around this topic. I like to explore, select a category because it helps me to see all the categories that are available. My particular question may not be available in CHIS as robust as it is. It has a limited set of questions that were asked in health topics, but we can certainly look at some topics that may be closely related to what I'm interested in. So we can see from health status, health conditions, behaviors, access and utilization, insurance, mental health, public program participation, demographics, and so on. Now, I'm interested in access to health care. So I'm going to select access and utilization. So when you select a category, you'll see some of the topics that are available within that category. And we can see here, we have usual source of care, doctor visits, emergency room use, hospital use, and so on. I'm going to select usual source of care. When we select a topic, you can see the number of questions and the type of questions that were asked in this topic category. So we can see the most recent year is displayed, and for CHIS, 2019 is the most recent year for data available. And so we can take a look at, have a usual source of care is at the top, type of care, received healthcare from a provider through video or telephone conversation, and so on. There's a number of topics that are available here. I'm interested in have a usual source of care. And it's helpful to take a look at what's involved with this particular question. We can see that it was asked for multiple years to 2019. CHIS was first produced its first estimates in 2001. And so that we can look at, this is a standard question that's been asked for every year of the CHIS survey. We also look and see that there are all of the age groups that are included, and we can see what are the results I expect to see displayed. And it shows here that it has a usual source of care or does not have a usual source of care. It's also helpful to look at how this question was constructed. And there's an explanation here for 2001. Since this question's been asked for each and every year, it's been pretty similar for how they constructed this question for this estimate. So it tells us that the variables created by consolidating multiple yes or no questions from the different age surveys. It also tells us that those who report that they go to my doctor or a doctor or to a specific health provider, they're considered to have a usual source of care. So it's really helpful to see how that was constructed to see if this is what you're looking for. So I've selected usual source of care, and that's displayed in my topic area. Now, you can compare topics. We'll talk about that in a second. That's optional. We can limit our population. We'll talk about that as well. That's also optional. And then years. So it defaults to the most recent year that's available. There's more that you can do with years, and we'll show that as well. So let's see what we have here. So now we can see, have a usual source of care, and we can see the estimate for each response. So have a usual source of care, 83.4% of those in Los Angeles County responding to the survey reported that they have a usual source of care. Now this is of our sample size, but that's used to estimate the population as a whole in Los Angeles County that would answer that question. So we will see that 83.4% has a usual source of care. So when you hover over that, that figure, it gives you an explanation of how to read that estimate. This second line is the confidence interval. That's a range, a percentage from 82% to 84.9%. Confidence interval is helpful in understanding of how accurate, how much confidence there is that that estimate reflects the true value for the population. So we can see that it has a very narrow range. The narrower the range, the more confidence there is that this is a stable estimate that reflects the true value for the population. This is a 95% confidence interval, and you can read about the confidence interval by clicking the tab on the lower left-hand corner. Now, if you have an unstable estimate, we'll take a look at that in a second. You'll see that range broaden, and we'll talk about that. So now we can also compare quickly to geography. We can compare to the state. If we had multiple geographic areas that we're looking at, we can select one area only. But right now we want to compare to the state. This is for how Los Angeles County compares to the state of California. And as you can see, they're fairly close. For the entire state, nearly 86% say they have a usual source of care, very strong confidence interval, and you can see the estimate for the population. Similar to does not have a usual source of care, and you can read that data in the same way. Now, this only gives us a very narrow picture. Who has a usual source of care is something that I'm interested in. As it gets more at the question as to who may be affected by having a usual source of care and what that means in terms of what barriers may exist, what are some other factors for supporting those that have a usual source of care, and what are some of the barriers for those who do not. So one of the things that we can do, and I said I'm interested in disparities, so I want to take a look at a comparison by race and ethnicity for usual source of care. So I'm going to select compare topics. And that brings me back to our topic categories. So I can compare by insurance coverage or other factors. But I want to look at race and ethnicity. So that's going to be in my demographic category. And we can see a number of variables within demographics. I'm going to select race ethnicity. And when I make that selection, it shows me a number of options here. And these are agencies and ways of categorizing race ethnicity by these agencies. So the first up is the Department of Finance, Office of Management and Budget for California, the Census, and then for the UCLA Center for Health Policy Research developed their own method for categorizing race and ethnicity. When we click that topic, we can see again, this was used for all years of CHIS, and it shows us all of the different categories that are available: Latino, white, Black, African American, Asian Pacific Islanders, and so on. What we want to know is, how did they come to this category and what does it mean? So when you click on more, it describes for 2001. It's been pretty stable for all years. So this would apply in all years. So it tells us that this is a variable used by the California Department of Finance. Latino is considered to be a race category for this variable. So that's why you see Latino as a race with all other racial categories identified, but also with the appendix that these are non-Latino racial categories. We could look at census. With a census, you can see how they've categorized their racial categories. If you notice, there is no Latino within this category. And so for Los Angeles County or even California, that may not serve our purposes, may not give me enough information. So so this is the census. So I want to look at UCLA. So this is in 2007, the center using their own method for categorizing race, and we can see that we have all race categories represented. And it tells us how they have constructed these categories. So if the respondent, for CHIS, this variable takes into account the group that the respondent most identifies with. So this is who the respondent considers, what race they consider themselves to be. So those are some options, and so it's helpful to read the topic and how these variables are constructed. So I'm going to select race from the Department of Finance, and this is the most commonly used. Again, we're in 2019, so let's see what the results are. Now, here's the unstable estimate. And what this pop-up message tells us is that your query includes statistically unstable estimates denoted by a red asterisk, and it's not recommended to report this data because the estimate is unstable. And we'll take a look at our results. There are solutions. You can pool years, which is to increase the sample size for that population within your query. You can also collapse topics. So we'll take a look at those solutions. But let's see what we have. So you can see that for some racial categories, we do not have any estimates because the estimate is unstable. It cannot be shown. There's not enough representation in the sample size for that population for Los Angeles County for 2019. So we also see that for Native Hawaiian Pacific Islanders. And if we look at this, we see that red asterisk there for having an estimate, but the confidence interval is quite broad, from 42% to 100%, meaning that it is not a true value for this population. And also we have unstable estimates for 2 or more races. So one of the suggestions is to pool years. So we can go into our years field, and we can see all of the years that CHIS has been available. I'm going to select the most recent 5 years. Now you see it defaults to compare. That means that it would display each year, but what we want to do is pool the years all together. Now let's see the results. Again, we still have unstable estimates. So pooling did not quite solve it. We're going to try collapsing topics next. So we can see that we have estimates for all populations, but we still have those where there are unstable estimates. That's our American Indian, Alaska Native, and Native Hawaiian Pacific Islander. We've stabilized two or more races within this estimate. So one of the ways to stabilize our estimates is to collapse our compare by topics. We only have one topic, but we're collapsing those ethnic racial populations that we've included in our comparison. So we're going to bring together those populations where there was an unstable estimate, Native Hawaiian, American Indian. We're going to also include two or more races. So now let's see if that solved our problem. All right, we've stabilized all of our estimates, and we can see now that each population, the estimates for those having or not having a usual source of care. They're fairly close across the board. With again, though, Latino at 80%, having a usual source of care when compared to whites at 90%, African Americans at 90%, and Asians at 84%. And then when we look at does not have a usual source of care, we can see that Latinos have a high percentage of those reporting they do not have a usual source of care. And when compared to whites at only 9%, African Americans at 10%, and Asians at 15%, you can see that's a significant difference. So I want to explore this does not have usual source of care and take a look at how this population is distributed in answering that question. So one of the ways to do that is to adjust our layout. So we're going to change the denominator to be the usual source of care question. We're going to transpose our topics. So now we can see the distribution of a population in answering that question. So I'm going to take a particular look at usual source of care because that tells us within a population how many of those are seeing a healthcare provider or getting advice or getting information, and that has an influence on whether or not they get the information or early treatment that they may need for their health. And so we can see that Latino represent the largest percentage of those answering this question that they do not have a usual source of care. It's the highest percentage when compared to the other racial categories. So this gives me a better picture of what's going on and may lead me to look at what are some of the factors. It could be immigration status. It could be whether or not they're employed or not employed. And we can add those variables in as we use AskCHIS to deepen our analysis. So one of the things I like to do is take a look at other ways of visualizing the data because it helps to perhaps clarify the differences in the different categories. So we can see here that under this bar chart, you can do a pie chart, but I think you can see that, again, Latinx is the largest percentage. But I like this bar chart because it really shows in a stark visualization the differences within these populations. And we can see that even though there's a 45%, 46% rather percentage of saying of Latinx who say they have a usual source of care. When we look at does not have a usual source of care, you can see they're far outpace all other race ethnic categories for not having a usual source of care. So one of the things that's helpful is to look at whether or not over time, is this the case? Or is it just for those years that we've looked at? So one of the things that we want to do is take a look at trends. So it asks us here, what do we want to look at? What do we want to trend? Does not have a usual source of care. And we would see that trend line. There's no trend line because we've pooled our years. We need to change the year category to compare. Now, we'll turn back to the table, so we'll see those unstable estimates, but we are going to go from that, from each one of the years showing. So we're going to ignore unstable estimates because we're trending the data. Now we can do trend because we can see all years. Tennessee does not have a usual source of care. And in the trend line, you can see consistently over a 5-year period that Latinx far outstrips all other population categories as not having a usual source of care. So with that persistent disparity, it's an area that we can take a look at with estimates from CHIS data showing the consistency of not having a usual source of care among Latinos. So these are some basic tools. If you need assistance in utilizing tools, there's certainly the tutorials, and there's a link to how to get support also on our survey at the end of our presentation today. Other things I want to point out, I can save this query to my library, as we can see here, and I can come back to this and further manipulate the data to look at the other variables, and I can export it into an Excel spreadsheet to do further analysis. So with that, I'm going to stop sharing my screen, and I'm going to turn it over to Jacob Rosales, who's going to go over Neighborhood Edition as well as the COVID dashboards.
Thank you, Peggy. Hello, everyone. Good morning. My name is Jacob Rosales. I'm the CHIS Data Dissemination Manager, and I'm going to be doing a brief training on using AskCHIS Neighborhood Edition, as well as giving you all an overview and brief training on our COVID-19 dashboards, specifically our 2020 CHIS preliminary monthly estimates for COVID-19 that we had for the CHIS 2020 survey. So let me begin by sharing my screen. Okay. So this is essentially the AskCHIS landing page that we have on the Center for Health Policy Research webpage. You'll notice up here that we have this green, on the header, we have these green options here. They're on every single page for the center. So you don't just have to be on the landing page of the center, you can be on any other page and get a quick access to AskCHIS or our COVID-19 dashboards. Here to go to AskCHIS. It's the great thing with AskCHIS and AskCHIS Neighborhood Edition is that it requires the same login. So once you've signed up to use AskCHIS, that's going to give you access to AskCHIS Neighborhood Edition. You just use the same username and the same password that you have for regular AskCHIS. Before I get into kind of like the nitty gritty and the nuts and bolts of AskCHIS Neighborhood Edition, I just want to let you all know that there are some differences between AskCHIS Neighborhood Edition and regular AskCHIS. Regular AskCHIS, this is drawing direct estimates from the survey data. So what Peggy was going through, these were direct estimates from our survey data. Now with AskCHIS Neighborhood Edition, we are providing more estimates at smaller geographies. So you noticed in AskCHIS, it was a lot of counties, statewide estimates, and then you had smaller estimates for smaller geographies for, let's say, Los Angeles County, the SPAs, and then San Diego County, the Health and Human Services districts. With AskCHIS Neighborhood Edition, we are providing estimates at not only the county level, but also cities, zip codes, legislative districts, those being state assembly, state senate, and congressional districts. And also we provide estimates at census tract level. Because we do that at smaller geographies, AskCHIS Neighborhood Edition requires the use of modeled estimates. These are small area estimates. These are modeled. So these are a little different from direct survey estimates, a lot of modeling and some sort of statistical analysis involved with it. So there is a difference between the types of estimates that you're getting, but with the small area estimates, they allow us to generate and derive estimates at smaller geographies. So they're very useful for folks that want to have a more granular, maybe more look at more of like a neighborhood, if you may. That's why we call it Neighborhood Edition. So let's go in there. So you see, this is the landing page for AskCHIS. I'm just going to say AskCHIS NE just to shorten up. So AskCHIS NE, we have our main landing page. We have the different topics that you can look at: environmental factors, health topics, sociodemographics, and vulnerability indices. Now, before we get into that, I just want to point you all to this help section here. If you select on this, it's going to provide you more detail on, a little how-to, more general information on the different indicators that we provide, data limitations and use, a methodology brief, GIS information, and the FAQs. So I highly recommend familiarize yourself with this. If you're going through and you're using the platform and you're a little confused, highly recommend to come check out the help section. It may help you out. If not, feel free to email us at chis@ucla.edu if you have more specific questions that this section can't answer. Back to the main platform. So yes, we have a myriad of different topics here in our health topics. Health topics, all of these indicators here are model estimates from the CHIS, from the California Health Interview Survey. Environmental factors are from CalEnviroScreen. Currently, we have CalEnviroScreen 2.0. We're working on updating to CalEnviroScreen 3.0. We do know that 4.0 was released as a draft, but we're going to wait until they finalize 4.0 because it's just as a draft format, and there's most likely going to be revisions made to that. So in a couple of weeks, we'll have CalEnviroScreen 3.0, and then in the near future, when they finalize CalEnviroScreen 4.0, we'll update that as well. Our sociodemographic section. This is all data that comes from the Census's American Community Survey. We use the 5-year estimates. So if you see here in 2018 age, that's going to be the 5-year estimates 2018, 17, 16, 15, and 14. So all the sociodemographics here are from the American Community Survey. We have the vulnerabilities indices that we've also included this year. These different area deprivation index is one from, I believe this is from Health and Human Services. Healthy Places Index, that's something that's specifically for California. Preexisting Health Vulnerability Index was something that was created from 2016 AskCHIS NE estimates, and it was looking at COVID-19. And then the Social Vulnerability Index is from the CDC. All these different indices here, they're only available at the census tract level. That's very important to know. We only have them for census tracts. So when you're looking at them, you only have to be looking at census tracts. If you look at other geographies, it's just not going to come up. It's not going to come up with anything for counties or for legislative districts, etc. Another thing with the health topics. So we're up to date from 2012, 14, 16, and 18. In 2018, we also included some new indicators. We included a new tobacco indicator, which is e-cigarette use for adults 18 and older. And likewise, we included 3 new oral health indicators in 2018, that being a condition of teeth for adults 18 and older, uninsured adults for dental insurance, and visited a dentist 18 and older. All right, so now I've gotten over all the kind of the nitty gritty with regards to discussing the different topics. Let's actually roll up our sleeves and let's look and see how we can use this. So I'm interested in looking at diabetes. I want to look at diabetes for 2018 and specifically in South LA. So what I'm going to do is I'm going to select diabetes 2018, ever diagnosed with diabetes, adults 18 and older. I make this selection, and you'll notice here I have a data table, and it just automatically just generates the estimate for the state of California. Now I want to add some extra geographies. I go to location. I get this pop-up here. I'm going to search for Los Angeles. I'll enter Los Angeles County and the city of Los Angeles. I'm looking at South LA, and specifically the zip code is 90003. I add that. Now I'll just go to create a table. You see I have a data table that gets generated. It provides the estimates for each one of these geographies. The map also gets generated. It shows the zip codes first. So if I want to toggle and change the map to look at cities, if you notice here, I get this, the icon with the clicky hand. I select that grid there, and it's going to switch over to the city of Los Angeles and show me cities. Go to counties, it's going to switch to counties. Let's go back to the zip codes. So you see here on this map, now this is it's all going to change. It's interactive. So as I hover around, you see that I have a legend table, and it shows the different zip code. It shows what the estimate is. You'll notice some of the geographies, they have a hash mark out, and that's because it's either the estimate is unstable or the suppression because of an unstable estimate or population size. So if you just hover over that geography, it'll let you know in the table what's going on with that. You also notice here we have a demographics panel. If you click on that, it provides you information on the geography's federal poverty level, race and ethnicity, and the population by male and female and age. So as I hover through this map, you'll notice that they change. Scroll down a little further, you'll also see a histogram. The histogram, it shows essentially a breakdown of all of the different geographies. It provides where the state level is, and then it shows where your specific zip code is. You can scroll this to filter out, to only look at specific geographies. We also have the zoom in tool to zoom in and out of the map. You can use this, or you can just use the scroll wheel on your mouse if you have it. You can also click on the state of California here to have it zoom out to the entire state. Now, and then you also notice here, we have a simple graph that shows you a breakdown of each one, and then a line demarcating where the state is to see. You can pretty much see, oh, hey, I see that my zip code is above the state level. I see the city of Los Angeles is above the state level in Los Angeles County. And then it also allows you to compare. So I can see that my zip code that I'm looking at is the highest among all these different geographies that I'm looking at. Export. You can export a PNG of the map. Just select the map. You can save it, and you can see it generates a map in PNG. If you don't like the zoom, all you have to do is just zoom in deeper into the map to get it to the level that you want. These work great for PowerPoints, highly recommended if you're doing presentation and you want a quick map to have. This is a real easy way to generate it. If you want the data, you can do an export table. I'll export the data as a .csv file. And again here, the data that is in the data table up here, it gets plugged into the CSV file that you can download. Please note, just for the purposes of this training, I'm only looking at diabetes, but I can put as many indicators, as many health topics, environmental factors, sociodemographics as I want into this table to look at. With regards to the number of geographies that you can look at, the limit is 5. So you're limited to 5 geographies. So anyways, we've looked at essentially diabetes in South Los Angeles compared it to the city of Los Angeles County in California. But I'm also interested in looking at maybe other jurisdictions, other geographies. So let's go back into our location tab. And what I want to do is I want to find a legislative district. So I can type in an address that I have at that zip code. And it's going to provide me with that information on who the representatives are in each district that it's in. I can add this to the table, create my table. And you see that now I have Assembly District 59 added. It's in the graph. I can look around and look at these comparisons, etc. Now, we have included for 2016 and 2018, we have census tract data added to this. Census tracts are great because they're much smaller geography. You can really get at a much better understanding of neighborhood and neighborhood inequalities, health inequalities, etc., with using census tracts, especially when you're in more urban areas. Let's go into location. We're going to select a census tract. Now you see here that it says I've reached the maximum 5 geographies, so I'm just going to remove my zip code. And there's multiple ways you can search for census tracts. You can either just do it by looking at the map. The default takes you to LA. And if you understand the lay of the land and understand what's going on, like the different roads and stuff, you could select your census tract, but it's kind of hard because these are all displayed as like, Los Angeles County tract 2171, San Diego County tract 2025, or etc. But we have a search census tract by address tool. This is a quick lookup, and this will essentially take your address and it'll do a quick API run through the census tract API geocoder, and it will take that address and pinpoint a census tract that it's in. So here I've selected this address. You can see it's kind of right on, it looks like it's right on the border. I'm just going to go with what it's saying, but if you see a census tract that's right on the border, you might want to say, hey, I want to look at both of them. But anyways, I'm going to add this census tract, create my table. The map gets generated, and you see that I have the different, now that I have my different census tracts, and you have a much better understanding of what diabetes looks like. And this provides you a map of all census tracts in California. So I can zoom out and get a better understanding of what's the geographic distribution, if you may, of diabetes in Los Angeles, as well as if I just scroll around, I can look deeper into California itself. So that's looking at census tracts. Another tool that we have with our census tract lookup is we provide creating custom geographies, pooling geographies together. There's 2 ways that you can combine geographies. If you wanted to pool, say, counties together, you could use this lookup tool. So I could search San Diego County and Orange County, combine those together, and just simply do that through here via census tract. Wait for this to load. I'm going to go back to that same tract that I had before, and I'm going to create essentially a larger neighborhood based off of the different census tracts that are around it. You see that I found those tracts. Now we have this lasso tool, so maybe you want to combine like 6 or 7 or 8 or 9 or 10 tracts. If I use this lasso tool, create a neighborhood from here, and then it'll quickly do that. If you found that, using the lasso tool, I've added too many tracts, all you can, to remove a tract from your selection, just click on it. So if you don't like, no, I don't want to include that, you just click on it. I'm going to include all these. And now here I'm going to say combine selected tracts. The default is it turns it into what's called census tract group 1. Table. And you see the map is plotted my census tract group 1. It's created the estimate of diabetes prevalence in this specific pooled area, combined area. And then I can compare it to the other geographies that I've selected. This is just a brief overview on using AskCHIS NE. There's lots, I highly recommend you all go through, check out the different health topics that we have. We have a myriad of health topics. The sociodemographics help you get an understanding of, the distribution of race and ethnicity. The vulnerability indices are really good to use. Please note on the vulnerability indices, I'll just quickly go through this real quick. These are a ranking. And it's not showing up because they're not pool. So unfortunately, the vulnerability indices do not pool. So I just have to quick put a census tract. I'm just going to select one here. I'm going to add it. And just real quickly on these vulnerability indices, I'm looking at the pre-existing health. The index is a ranking score where 0 represents the lowest and 100 represents the highest vulnerability. If any tract has a value of -1, it indicates that the index ranking was not constructed for the tract. It's very important. This logic is implemented for all of the different indices that we have. So it's a ranking score, 0 being the lowest vulnerability and 100 being the highest vulnerability. A -1 score indicates that the tract did not have a score. Anyways, that's AskCHIS Neighborhood Edition. Now we're going to move over to our CHIS COVID dashboards that we have. So in our health profiles section on this green tabs up here, if you just click on the COVID-19 dashboards, and you see we have a menu of the different dashboards. We have our 2020 CHIS COVID-19 preliminary monthly estimates dashboard. We also have COVID-19 rates and risk factors by California County dashboard, the COVID-19 rates and risk factors by California County data table, and our Native Hawaiian Pacific Islander COVID-19 data policy lab dashboard. I'm going to focus on looking at the 2020 CHIS COVID-19 preliminary monthly estimates dashboard. Here's our dashboard. We have a menu of different tabs, kind of different topic areas. We have a COVID-19 treatment, sub-state estimates, Asian, Native Hawaiian, Pacific Islander specific COVID-19 questions, personal impacts of the pandemic, conflict during stay-at-home orders, main reason for not having health insurance, and a methodology section. So on our COVID-19 treatment, we had these questions that were asked in the 2020 CHIS. They were, if respondents ever had or thought had COVID-19, they contacted health professional about COVID-19 concerns, health professional suspected respondent had COVID-19, if they were ever tested for COVID-19, and if they ever received a positive test result for COVID-19, and if they would get the COVID-19 vaccine if available. On this dashboard, you can look at the estimates for May, June, or July. These are statewide estimates. You can filter these graphs by these different areas, by these different topics: state total, age, sex, race, ethnicity, California region, educational attainment, citizenship status, household status, family type, insurance status, federal poverty level, risk factor if they had asthma, diabetes, or high blood pressure, or asthma alone, diabetes, or high blood pressure. Going to our sub-state estimates page. Spinning wheel. Going back to our sub-state estimates page. You see here that we have these sub-state estimates. Some are a county, some are essentially combined county groups. We have them for pooled for May through August or May through June. You can filter by a different topic: COVID-19 treatment, conflict during stay-at-home orders, or personal impacts of the pandemic. Select questions, and then you can filter the map by a myriad of different topics here: age, gender, race, ethnicity, insurance status, poverty, risk factor, asthma, etc. Hovering over it gives you the information here. You'll get the estimate, the confidence interval, and what it was filtered by, essentially the universe, if you may. And then you also have a table here presenting the estimates for each county, each sub-state estimate. We have the Asian, Native Hawaiian, and Pacific Islander specific COVID-19 questions. During the pandemic, as this is well aware for most people, there's been an increase in hate crimes towards Asians, Native Hawaiian, and Pacific Islander persons. So we created a specific module that asked questions specifically directed to these populations. Those questions being if they directly experienced a hate incident due to COVID-19 in the past 12 months, what type of hate incident they experienced, If they witnessed another Asian or Pacific Island person being treated unfairly due to their race, ethnicity, or national origin, if they've had difficulties performing work due to poor internet or lack of usable computer, their main source of updated news and information about COVID-19, and types of bills and trouble paying during the COVID-19 pandemic, and then views on government and education system during the pandemic. You see here, each of the graphs have different filtering. So similar to the other ones, these all filter based off of different topics here. And quickly, we also have personal impacts of the pandemic. These are for the months May through August. And then look at, if they continued work as an essential worker, switch to working from home, reduce job hours or income, financial difficulties with basic necessities, financial difficulties with rent, lost a job, experienced other challenges, treated unfairly due to race, ethnicity, and childcare difficulties. The graph by different topics. Conflict during stay-at-home orders. There was any increase in conflict, punishment at home, snapping or yelling at family members or loved ones, interpersonal conflict with family members. And again, it can be filtered by the different topics. And finally, the next section, main reason for not having health insurance. By the different months, May through August. That is our COVID-19 2020 preliminary health estimates dashboard. We do have the CHIS is in the field for 2021, and in the next, probably I'm thinking off the top of my head, it'll be late spring, early summer, where we'll be continuing having these estimates for the 2021 CHIS. So be on the lookout for those. With that, I will turn it back over to Peggy.
Thank you, Jacob. So now we'll take questions, and I want to thank Tiffany Lopes, our communications director, who's been putting information in the chat box. And I'm going to turn it over to her to moderate our Q&A. We're running a little over, so I hope you stay with us for the Q&A. But Tiffany, I'm going to turn it over to you. What are the questions?
Thanks, Peggy. Good afternoon, everyone. Like Peggy said, my name is Tiffany Lopes, and I'm the Director of Communications here at the Center, so I'll be moderating the Q&A. We've got a few questions from the audience, so if you do have questions, there's still time to go ahead and ask them. So Jacob, let's get started with you.
Yes.
In NorCal, there are 2 groups of 7 counties each. Can AskCHIS NE be used to get single county specific data?
Yes, you can get single county specific estimates for, if you notice in AskCHIS, they're grouped. In AskCHIS Neighborhood Edition, we have single county. The only thing to really keep in mind is that they're modeled estimates, they're not direct estimates. But also note, because of population size, I believe it's Alpine County, most of that is suppressed just because it doesn't meet our population thresholds. So that's one of the tricky things with dealing with rural areas, is sometimes we have to implement data suppression because just the population size is so small.
Thanks. Are you able to integrate California immunization registry data for COVID vaccinations? I think this is a question about the preliminary estimates dashboard.
I think that's something that we have to consider and look into, and also how do we get what the access looks like, and also what the data looks like concerning, is it just county level or is it just statewide?
Thank you. This person says, I like the zip code level for LA County. Is there a way to outline Board of Supervisor districts to look at zip code data within district boundaries? Also look at zip code data by SPA boundaries, which is service planning areas.
So for that, the best way to do it would be, you'd want to combine your geographies. So if you know if you know the zip codes that create like a board of supervisors, or kind of, if it could be census tract, it could be zip code, etc. If you know those that kind of create it, then you just go into the combined geographies and make a combined geography and say, okay, this is my board of supervisors district 1, and then combine the geography, and then it'll derive an estimate for that geography based off of whatever health topic it is.
Thanks. If the Department of Mental Health is interested in having a particular indicator they need to track, would it be possible to get it added to AskCHIS NE?
Yes, well, we just need them to send us an email and get in communication with them about it, and we can look into adding extra variables to AskCHIS NE.
Great, thank you. We have a few questions here, I believe, about AskCHIS. Is there any way to ungroup the rural counties?
In AskCHIS, no.
Okay. Is there a way to see if the differences are statistically significant from a reference group?
We do not provide any significance testing in either AskCHIS Neighborhood Edition or AskCHIS. You could look, and you could do the simple look to see if the confidence intervals overlap. But again, I think this is, I view these tools as more of just kind of get an idea of what the estimates look like. It could be a little possibly problematic if we start doing statistical significance testing and inferential work there.
Thank you. It looks like those are all the questions we have. I just want to remind people, if you're a member of the media, a journalist, or anything, and you would like to contact us to speak to an expert, we have several of them. You can email me. I dropped my email address in the chat, tlopes@ucla.edu, and you can also contact Eliza, who is our public information officer. I am also going to drop the survey in the chat one more time. If you could fill out the survey, it's quick and will help us better identify how we can serve you the next time around.
All right, I'm just sharing my screen here, showing some of the resources that Tiffany has placed in our chat box. I do want to thank AJ Scheitler, who is our Director of Stakeholder Relations, who's joined us. She works with statewide health surveys, so it's good that you joined us today, AJ. And I want to thank the Director, Principal Investigator for CHIS, and the Center Director, Inez Ponce, and Todd Hughes, our CHIS Director, and again, the California Endowment. Please complete the survey. It really helps us to know how useful today's webinar was. And also there's a box in there to let us know what your needs are and how we can support you, and we'll follow up with you. So with that, thank you. Is there anything else, Tiffany or Jacob, before we close out?
I think that's it. Thank you so much for attending, everyone. Have a great day.
Thank you all. Have a great weekend. Take care.
Bye-bye.